Good afternoon, everyone. My name is Christine McClement. I'm the Global Head of Marketing and Communications with exocad, and I have the great pleasure of welcoming you all to today's live demo. In the name of all involved partner companies, Medit, VHF, VITA, and exocad, I hope you enjoy Dr. Gulshan Murgai's live case presentation today. Now, it's my honor and great pleasure to hand over to Dr. Murgai, sought-after dentist, speaker, and digital dentistry advocate. In his North London practice and dental lab, he uses only cutting-edge technology and will now present a seamless same-day dentistry restoration live. Gulshan, the floor is yours.
So hello everybody. Firstly, thank you for joining us. I am with my team here, Karina, my nurse. We've also got our patient right here behind me. This is Marion. Give them a wave. I'm going to tell you more about his case in a minute. Behind the scenes on the camera over there is Niall. So what we're going to do today is Marion made an appointment a few days ago to say that he had chipped a tooth on the top left-hand side. Niall's going to show you the x-ray in a minute. So we just about 20-30 minutes ago saw this for the first time. This is real life everyday dentistry that we're going to show you today. So we had a little bit of a surprise, and we're going to deal with that as we go through the session. The session is going to be a live session where we do the preparation of an upper left first molar tooth. This is a tooth that 7 or 8 years ago I did a molar endodontic treatment upon, and I think Niall will show you that x-ray in a minute. So there was a large composite restoration in there for 7 years. Unsurprisingly, he's chipped that, he's worn it, so it's a good candidate for a full coverage restoration. So we're going to use a ceramic onlay kind of restoration on that. The surprise today, which we only found out about 15-20 minutes ago, having taken an x-ray, was that there's also some primary caries in the adjacent tooth, the upper left second molar. So I'm going to just have to deal with that today, and this kind of shows you real life dentistry. Okay, so here we go. It's going to be a little bit noisy, just like a regular dental surgery. There are people in the background taking questions, so you can use the Q&A button there to pose any questions you like. I'm going to get busy. We will be designing, we'll be scanning, we'll be milling, we'll be fitting, and then while the machines downstairs are milling the restoration live today, I'm going to go through a presentation of a more complex case with the same product, and that product is exocad's chairside CAD product. That's what we're using today. We're also using Medit's i500 intraoral scanner. We're using ceramics from VITA, and we're using a milling machine from VHF. So let's get started. Okay. All right, so lots of noise, lots of water to start with. And what we're going to do is take out the old filling and do whatever we have underneath. Okay. So people watching, now we'll show you in a minute. We have a pre-op X-ray. We also have an intraoral image that we took. So I've got a large composite restoration here, and what I'm going to do is just remove that. No anesthetic is in because we have a non-vital tooth here. The little challenge is that the adjacent tooth in front of the 6 has got a partial metal restoration, so that'll be fun to scan. And the tooth behind has some caries, and we will be dealing with that as well. So here we go. It's going to get a little bit noisy. Just for anyone concerned for our safety, we have air purifiers on, we've got adequate PPE on, and we've got extraction running, so we are COVID safe. Please don't worry. Okay. So what I'm doing here, guys, is I'm first reducing the height of the seat. We're going to be using felt-static material. That's my choice at the moment. I have a tendency to change my mind, so it may become something else. So I'm going to reduce the height by around about 2 millimeters to give ourselves plenty of room. I'm using a flat diamond disc in a high-speed handpiece. Okay. So generally, this is what people tend to have problems with in ceramic dentistry, is not reducing enough height, not giving their technicians enough space. And so I'm going to show you what we're doing. You will see the scanning as well. Okay, just switching to a different instrument, another verb. So this is quite typical of our practice. We do quite a lot of endodontics, and when we're doing endo and molars, often they receive a indirect restoration. 90% of the time that's being done here at same-day dentistry. And we've been doing this kind of thing here in this building for over 16 years. This is our 17th year. So for Marion, this is the first time he's had same-day dentistry. So later on, we'll be asking him what he thinks. Okay, so we're getting to the bottom of the composite. I will be removing pretty much all of it. Now, do you want to see if you can get in here? So take a picture of my mirror and just look at my mirror. Yeah. Brilliant. Okay. So there's the preparation. If you look at the mirror right there, live dentistry for you. So I've taken out the deep composite, still a bit more to go. Alright, so we know that we have some digital caries on this tooth as well. So now I'm going looking for that. And there we have it. So we're about 80% done on our preparation. And while I'm preparing the tooth, I'm thinking about the design of the restoration, I'm thinking about what's going to be easy and difficult to scan. I'm thinking about emergence profile, insertion direction. And the reason for all of that is that when we're doing this kind of chairside clinical visit dentistry, I am the technician as well as the dentist. We've got pretty good height reduction. Directly below the tooth, Mary's got a screw retained implant restoration out of zirconia. So it's important that the design of this restoration is one that can take quite significant loads. So my preparation all the way around is effectively a shoulder margin. Wherever I can, I will conserve tooth and keep the height as high as I can. But we don't want to compromise strength of the restoration either, because we're expecting this to be there in 10, 12 years' time. The reason I say that is that our personal success rate at 10 years is 98% with this type of restoration. Okay. Putting your thumbs up with the left hand. All right, good. So I'm really lucky to have Niall helping us out on the camera. I was actually a dental technician. Another dental technician downstairs as well. So there are plenty of people around to criticise what I'm doing and how I'm doing it. So maybe we'll get Niall's opinion once I'm designing. This is an interactive forum, so those of you out there that have questions already, please go ahead and ask them. We have cameras there to answer them. We have done with my preparation. Now I'm going to get a little bit closer in a second. So people often ask me about how I do the deep preparations that we do, and I'm going to show you some of those tricks. It's really about tissue management, managing the site, managing bleeding. So not just the tooth, but the surrounding tissues as well. So right now we're going to use a astringent in gel form called VITA, available worldwide. You can use whatever you're comfortable with, okay? So now, if you want to get closer, I'll show you in my mirror. You can see a few things now. So you can see the amount of reduction that I've got. You can see there's some red stuff bleeding. You can see if I tilt the mirror like that, you can see quite significant mesial cavity in the second molar. We have told Marion about that, he's aware of it. Now, normally, I would offer the patient to do both of those teeth in one sitting, scan them both, prep them both, but because we only found out about 15 minutes before we started this session, we're going to defer that for another day. What we're going to do is just seal it with a temporary filling material today so that we can continue with the plan. So let me deal with the bleeding and then I will show you the day. Okay. So one of the things I need here is separation between the teeth. I need separation so that I have full control of the contact points. Now, as a lab owner, I see many cases coming through our lab where teeth are underprepared, and it's really great to be minimalistic and minimally invasive, but if it compromises the restoration, then perhaps that's a discussion you have with the patient to say, well, you want something long-lasting, or do you want something where I really conserve the tooth? And there are various factors to consider there. All right, so I managed to stop the bleeding in just a matter of seconds, actually. So that was a 30-second application, rinse it off, and we now have no bleeding. That was a pretty straightforward case. Others will be more complex. Just a little bit of caries clearance before we are ready to scan. Yeah, we will do this operation. So I'm going to use two different burrs to do this tooth preparation. I reduce the height with a flat diamond disc, running at high speed, and then I use a flat-ended crown preparation burr to get my shoulder all the way around. I'm now just using a composite finishing burr, very thin tapered one, to get my clearance. Okay, preparation is complete. So what we're going to do now is to seal the 7 with a little bit of temporary filling, and then we get onto scanning. Now when we get to the scanning stage, we will be using a lip and cheek retractor. So that makes access easy for us, it makes scanning faster, and you guys will get a better view as well. So that's coming shortly. Okay, so we keep cheek retractors in a couple of different sizes, and Trina usually gets the size right, and she said regular, so I'm not going to argue with that. The reason that we can't leave this cavity open is that the intraoral scanner will see it, and it will ruin what we're trying to do is creating a compact. Now, some people, if they have long enough, would go ahead and install that. I would do the same, maybe with composite. But as I said, this was a surprise a few minutes ago, so we have a finite amount of time this evening. I say this evening because in London it's coming up to 5:30 in the afternoon. Lovely. Okay, next is sheet retractor, and then we go ahead and start scanning. Okay, now we go. So again, this is something that people ask advice about. This is a optograde retractor available worldwide. And so I have a specific technique how I place it. You can have a look. Karina always helps me with this, and then the patient gets given some instructions. Marion's had this done before because he's had other scanning done before. A little bit. So there you go. That's pretty much in. We want to make sure it's secure, and it is. Okay, here we go. So what I'm checking for right now is that I can see all of the margins. I've got my insertion axis in my mind. And also what's really important now, as we're ready to scan, is that we have a dry field. So Karina is making sure of that. Okay, so we have already gone ahead and programmed our scanning software. We're using Medit i500 here. I've degloved and I'm going to handle my mouse. And for this period, I'm going to switch off the webcam and we're going to switch to screen share. So again, live real-time scanning. We told the software, the Medit software, that we are scanning an upper jaw and the lower jaw, and then we'll be doing a bite registration. Later on, I will tell you why I'm doing it this particular way. It's to do with the way I use the design software. Alright, good. And all we're going to scan here is going to be a quadrant, okay? So I've got my i500. It looks big and heavy. It's not. I can literally move it around just from the tip like so. I'm going to place it in the mouth towards the back, and I'm going to activate the scanning feature. And you can see the software has no problem at all with the shiny metal. Lots of talk on social media about how to scan and what speed to scan and things like that. To be honest, scan whichever way is comfortable for you. There are a few scanners that require you to scan a very specific way. This is not one of them. Alright, so I've pretty much got my quadrant and even more. I don't need all of this shiny metal, but what I do need is my distal surface of the 5, and very importantly the mesial of the 7, and there you can see why I had to put that temporary filling restoration in there, okay? And I've certainly got all of my track. Now when I turn off the camera, the intraoral scanner I should say, you notice straight away what it did was it tidied up the image, okay? Let me show you something else that we can do with Medit, which is called the reliability map. And that's going to show me where it's got good, reliable data that's well stitched together, which is in green, and red is areas where we might be missing some data. Now, as a practitioner and a designer, I'm looking at, well, what's important here? I just need my contact data. We have some missing collateral data here. So actually, I'm looking at the big screen over there. Now, if you want to show them that. And Krina's using the screen on the laptop. So ergonomics really important here. Just going to pick up that large bit of data. So we go straight back into the scanner and point that we've scanned before and just show it the areas that are missing. Okay, and this is usually where Krina gives me a nod because she's looking at data quality, as am I. Niall, are we good? Yeah. Okay. Right, fantastic. We've got enough data there. Brilliant. So I'm going to press the button to stop the scanner. Now, I don't even need to touch the keyboard now. If I press and hold the button on the i500, it will optimize that first scan, switch me into the next scan, which is the lower jaw. That's ready to go. This is how light the scanner is. I can hold my triple air tip and the scanner together. Go down, please. Go down. Perfect. Thank you. It's really important when you're choosing what scanner works for you to make sure you have a trial, not just on a model, but in the mouth as well. Okay, it's very different when you are scanning in the mouth, slightly easier. So what I'm doing here is I'm retracting Marion's tongue, and the cheek retractor is dealing with the soft tissues, the buccal area. Make sure that I've got my closing tooth, and I'm going to get some extra data as well, and you'll see why shortly. Alright, so on the reliability map, we're going from red to green. The more green we have, the happier it is. And I think that's more than enough data. Notice that if I come away and go back, we can go straight back in the mouth without stopping, without worrying. So that's me repositioning the scanner in my hand. And you can also give the patient a break as well. So that's done. I've done the opposing scan. I've pressed the button, it's tidied up the image. I press and hold the button again. It's now going to take me to my bite registration option. And this is also important here. So here, what we do is we say to Marion, please close together on the back teeth, tightly, and please do not open. Notice Krina is now making sure that the retractor doesn't pop out and hit me. And I'm going to go back in there. And the way we pick up the bite reg, this is a buccal bite registration, is we're scanning upper teeth, lower teeth, and there you go. We get a audible signal to show that we've got a good registration. Job done. Okay, that's scanning complete. How are you doing? You okay? Brilliant. So, Marion's okay. Now, really, really important, we're going to check data quality. So I've degloved. I'm going to have a look, and anyone that's seen my presentations before knows that I'm a little bit OCD. So I'm going to just make sure that my data quality is good, but also tidy as well. And I'll show you how easy it is to tidy up the scan. So I hope you guys can all see what we've got there. Let me zoom in. Full color scan. We can see the soft tissue. You can see where it was bleeding. You can see the metal there on the adjacent as well. I wanted to tidy that up real quick. Just do a bit of trimming, really simple. And I'm showing you this because this is what I do every day. I'm not doing anything special for you guys. All right, so that's tidy. I check my opposing. And then there'll be a little short break while the software does its final calculations, okay, because this is unprocessed data at the moment. That's why it's really fast. All intraoral scanners do that. They will give you the raw data first. Don't really need to tidy this up, but I'm really just showing you how easy it is with Medit software to draw a pattern and do that. So that's us done. So tooth preparation done, had a discussion with the patient, scanning done, and now we get into processing the data. you may have just seen there, the software gave me the option to have a STL file that's printable. So if you have a 3D printer, you could dump it straight to there. We don't need that for our purposes. We're keeping an open STL file, which we will be now moving into the exocad design software, and that's called chairside CAD. How are you doing? Okay. Alrighty, so I'm going to allow Marion to sit up. His bit is done for now, and that was around about 23 minutes. So Marion gets to have a rest, and I'm going to now concentrate on you guys. So typically at this stage, we take off some of our PPE. Because of COVID restrictions, I'm keeping my visor and my mask on, and hand gel, of course. If you look in the top of the screen, it says processing there. Hope you can all see my shared screen. And that's the data processing of the quadrants that I just scanned, and we will see the results of that shortly. Now in the background, let me show you, this is the chairside CAD software. This is the first part of it. It's called chairside DB, dental database. All right, so what I've done is I've got the patient's name here. I've got an area to write notes. I've got the entire upper left quadrant marked, the lower left quadrant marked as antagonist, okay? So in the upper left, we mark them as adjacent teeth, okay? And we can then go in and choose our working tooth, which is the 2/6. We can say that that's going to be an inlay-onlay, because we have an internal preparation here. We don't have a stump, we're going into the pulp chamber. Yeah, I think I would stick to my favorite material, which is feldspathic, and we will be using VITA Mark II for this particular restoration. And yeah, we've got all of our options here. We've got our minimal thickness, we have our cement width, and so on. So I'm going to go ahead and click OK, and you'll see that it's marked the 2/6 in green, and you see the legend in the middle. Okay. The next thing is to go ahead and click Save, and we have our options on the right-hand side, including the one that says Design. Now, we've got to pick up our data. We've done our scanning. The data is now all held on the Medit cloud server, so we're going to go back there, and we're going to go ahead and export that data. Now, there is the option in the Medit software to just push a button and dump it straight into exocad design software. However, I choose to do this manually, and I'll tell you why when we get into the design shortly. I'm going to tell it where we're going to put this data. We're going to just create a folder on the desktop in this particular case. And also what's important here is I'm exporting PLY data. So PLY data is the color format of the scan. An STL file would be monochrome. So that's all exported, and we can come out from the Medit software. Now that I know that I've got my data set and I know where it is, I can go ahead and hit Design in chairside CAD, and now it's going to open up the CAD element of the design software. So you can see there, chairside CAD. So on the big screen, we're sharing what I've got on the laptop. So Marion's watching over there. He hasn't seen this stuff before, so we'll ask his opinion at the end of the session. And what exocad's going to do now is it's going to ask me, where is the data? So I know where I placed it. I placed it on the desktop under his initials, and Medit has given me 3 sets of files there. So we've got upper jaw, lower jaw, and the occlusal data, and it's asking for upper jaw first. So double click there, there it comes. Lower jaw, there we go. So there is our data set. I've got a 3D mouse here and a CAD mouse here. So I'm using both hands now in the design process, okay? So the software says what the axis, the correct axis. Well, we've got that, that's correct. Next, I go ahead and place my margin. Now, what we have here is 2 options within exocad. We can get it to detect the margin itself, or we can go ahead and place it manually. Not going to show off here, but I am going to go ahead and place it manually because I know where it is, and I want to show you what you can do with this. So, I'm going to just turn off profile view. So, I'm basically going around the screen, around the restoration preparation margin, and I'm using the color data there. The software's helping me, so it's proposing where to go with this, okay? And you can see I can zoom in and out with my 3D mouse. I can also use my regular mouse. So I'm left clicking around the margin, double click at the end, and then, as I always say to my delegates is critically appraise your margin. Look at it from all around, okay? Now, because we brought in a PLY file, we have the benefit of using monochrome data as well. I'm going to show you how if you just push a button, there's the monochrome data. If you brought in just the STL file, you wouldn't have the option to switch into color. So sometimes you get better contrast and you can see where the margin is more clearly here. You can see where we're subgingival on the mesial area. And I know that I just need to tidy up my margin a little bit there. So these little round spots are called control points, and I can move them in and out and just modify that so that we get a really good accurate fit. And we are done. So we're going to hit next. And it will take us to the next option. So now what the software is doing is it's using the parameters that were set up in the DB feature to give us a different view where you can see it's gone silver. So that's our adhesive gap, and now it's asking me for my insertion axis. I'm using my 3D mouse to see where I can drop it in and negate the undercut. You can see here in red, this is undercut, which is recognized, and that's not really an issue because we're going to digitally block it out. Set the insertion axis, click next. And now what's happening is that the software is looking at the data. It's now giving me the option to copy a contralateral tooth if I have that data. I don't, so I'm going to go ahead and click next. On this next screen, this is really interesting. This is where we get to choose the design of the tooth, okay? If we turn our color feature back on and we use this other feature called True Smile, we can really show the patient what this restoration may look like. We have a choice of databases over here at the left-hand side. It's a generic. If I click that, I'll have a drop-down menu of other teeth to choose from. And what I'm going to do here is I'm going to help the software by giving it an idea of where I want to place that restoration. So I'm just moving it around using my mouse. I can scale it to make it a bit bigger. The pink there is my contact. Now I want to see a bit more data. I want to see proximity. And so it's really, really heavy pink now, but that's just fine because the software will take care of it. So slightly larger, there you go. And let's see what that does. We go ahead and click next. So what's happened is that the software, and it's still doing it now, you can see on the share, is it's taken that primary design, and what it's done is it's given me a proposed restoration. And now we've got a selection of tools on the left-hand side called free-forming tools. We can see our antagonist data here as well. You can see there's the lower 6, and that's the implant crown. You can see the grey shadow of the metal restoration. And we can look at it all in 3D and have a look at the proposed restoration. We have a bunch of colors there that show us the contact strength with the opposing tooth. We can switch those on and off. And Marion, you can see the proposed design of your tooth. What do you think? That looks nice. We can take off the adjacent teeth, and typically now I'm going to go through my typical design process, okay? So I would normally have it in the normal gold color. I'm going to try and ensure this is as smooth as possible, so easy to cleanse. Okay, so we're just using the smooth tool here to do that.
How important is it, Gulshan, for the patient to see the design stage as well and get their approval?
For me, it's very important. For years of doing this, I've always done my best to ensure that the patient has the option. But let's ask Marion, what do you think? I mean,
this is really weird, yeah, because every time you've done something for me, it's like everything was happening in the background, and that's it. I never saw it.
So, well, you're involved here, Marion. So, you know, you can tell me what you like and don't like. If you want to make any changes, I mean, there's your tooth. We're almost ready to send this downstairs to the mill now. So feel free to make any comments. We have our resident technician right here as well. I'm just going to check my results. Pretty happy with the contact there. That orange area shows quite a heavy contact, but a heavy stable contact. So not a point contact, it's an area. So as I said before, it's opposed by an implant crown. So we want to ensure that we have good stable contact and not point contact. The pink here shows that I've got a tight contact with my mesial neighbor, and that's a very heavy contact on the distal there. So we have an adapt tool here where we can ask the software to adapt that for us. We just simply push a button and it will go ahead and adapt it for us. We can also do it manually and adapt it that way. So I'm just looking at all surfaces of my tooth or my proposed tooth and going ahead and modifying it accordingly. We will soon be ready to do what's called a nesting. So that's deciding where to put this restoration in the block that we're going to cut it out of. And we now go ahead and select the blank, the production blank. So I can choose my production blank. Now, because I chose feldspar at the start, it's coming up with all of the different feldspathics that are in the library. And it is actually a coincidence, but VITA is the first one that's coming up. And what we'll do here is we will go with the Trilux Forte, which is a polychromatic block in 2M2. The reason I'm choosing that is because that's the shade we've used before for Marion, so I know it works. It's also created a sprue on the restoration, and what I'm going to do is just turn that around so the sprue is in a position that allows me to mill this and fit it as quickly as possible. So there you go, hopefully you can see that. And what's really important here is you can see the layer visibility there. You can see the different shades that are going to come up in this restoration. Okay, so it's not monochrome, even though it's a 6 and people might not see it. You know, we have the option of going ahead and using really nice looking polychromatic materials. Just going to check underneath to make sure that I'm happy with that. And yeah, that's looking good. All right, good. Okay, go ahead and hit next. Okay, so now we have a wireless setup with our milling machine downstairs. I'm going to just put in a lot number. In this case, I'm just going to use Marion's name as the data there. And then this software is going to communicate with the VHF Z4 milling machine, which is downstairs, and it's going to start sending the data across, okay? Alrighty, if you're watching on camera, you can see that the guys have gone downstairs. We have 29 minutes to cut that restoration, so quite a bit of time. It should be ready, yeah, absolutely, in 29 minutes or less. I'm going to go ahead and share my screen with you guys so that we can carry on talking. So there are, just so that you guys know, 29 minutes is not the normal amount of time it takes to cut one of these restorations. That's been set to high quality, gives me a bit more time to talk to you guys, and it may actually be ready quicker than that. The other thing is that that's an intricate restoration that has areas that go into the pulp chamber. It's a bigger restoration. If you were cutting a crown on that molar, if you had a good solid stump there, you could probably cut it in something like 12 to 15 minutes, even in high quality. So let's go ahead and we will talk about what we can do with the rest of this product series. So Chairside CAD is a modular product. It's one of exocad's 3 different products, and in forming it, they have spoken to a variety of different people, different intraoral scanning manufacturers, labs, 3D printer makers, machine makers, desktop scanners, and also material producers as well to create this. It is a modular structure, and I'm going to show you the modules in a minute. We use today the Medit i500 scanner. Obviously, you could use others as well, as long as they're open scanners. My choice is the i500. It's fast, it's light, and you can see a whole host of different features there that have allowed me to do this restoration today, and it's what I use every day. So, as I said, Chairside CAD is a modular product. We've used 3 or 4 of the modules today, and I'm going to show you how you can use some of those other modules to do other more complex works. So such as Model Creator, which is for 3D printing. We have the implant module, which is self-explanatory. You have a DICOM viewer, you have a bite splint module, and quite importantly, you have something called the Smile Creator module. And we will show you shortly how we've used that. Our other product partner today is VITA. We have just started milling a VITA Mark II feldspathic block. We have a choice of other materials here, and I'm going to show you later on where we have used those other materials. VHF have provided the Z4 milling machine. I've been using their products for 6 years now, and we have clients all over the UK that are using the Z4 for chairside milling. As I said, it's very fast, it's stable, it's in my reception, so I actually use it to actually showcase it to our patients so that they know what we're doing, how we're doing it. It really enthuses people to get involved in digital dentistry. And usually once I've placed one of these restorations for a patient, they'll often say, yeah, I'm absolutely happy to have another one because they've been involved. I'm sorry I'm having to show you the presentation like this. but because I'm screen sharing and we're using so much graphics power, I can't show you as a normal presentation, but I hope you're seeing everything correctly. Now, we just spoke about the modules in chairside CAD. This is one of the modules that I'd like to show you. This is the implant case module. I'm going to show you a complex restoration here, the lower right pair of molars. So this is the 6 and the 7. This patient had these teeth missing for around about 15 years. And it was my task to graft the site. We did that, left it to heal 3 or 4 months. We then went in, placed a couple of implants with guided surgery. It was done with another exoplan product from exocad. And we left it another 4 months to heal. And here you can see some images where I've removed the healing abutments and I've placed multi-pegs there to take the ISQ readings before going ahead and restoring them. And here's the process using a chairside workflow. So this is my nurse, actually, Krina. She's just out of the room right now, but that's her. She's in the chair. I'm using the Medit i500 to scan her mouth in that area. And I'm looking up in that last image because I'm using the big screen so that I can guide myself around the mouth. I'm not looking in the mouth. Krina's looking, or whoever's my assistant on the day was looking at the laptop screen so that they can follow what I'm doing and give me any pointers if I'm missing areas. Again, what we did was we've used the same cheek retractor, and you can see the next stage was placing the scan abutments, and this is the workflow with Medit, whereby you scan the area, the upper and lower, the bite registration, and then you get the opportunity to scan the scan flag, and it will put it all together. Actually, with Medit, you can use their artificial intelligence element whereby it will recognize the scan flags from series in a library, so it's very, very accurate. So that was placing the scan flags. I then used a process similar to what you've just seen in Marion's case, where I used chairside CAD with the implant module activated. And you can see me there on this very laptop designing those 2 restorations, but not just the restorations. I was also able to design the abutments, and I will show you how I did that. Something that people don't know that you can do with this chairside CAD product is you can still collaborate with your labs. I own a lab, but I work also daily with my technicians as well as doing my own chairside cases. And what I'm doing here is I've designed the abutments, I've designed the crowns, and I'm sending the data using Dental Share, which is part of the exocad portal, to transfer that data to the laboratory, and I've asked them to mill that and finish it in zirconia. So what Krina's got is 2 custom abutments and hybrids with titanium bases, zirconia on the top, and you will see those shortly. How did I design it? Well, I used the same software that you've just seen, and these are a variety of screenshots from different angles. You can see where the software has recognized the position of the implants from the scan flag. You can see how I've set up the occlusal scheme in exactly the same way I just did on the live case today. And again, some screenshots from my laptop there, okay? Moving forwards, what do I do next? I basically take that restoration, and just like I did today, I nest those 2 restorations. So what I did was I actually milled the restorations, the crowns here on the Z4. I used VITA's Mark II product again, so maybe a little bit controversial, but I used a feldspathic porcelain on top of a zirconia base, the zirconia base being the custom abutments. And one is designed to go perfectly on top of the other. So they're both designed right here on this same piece of software. So again, I used a polychromatic block there. You can see there the layer visibility. You can move those up and down so you can have different portions in the lighter and the darker areas of the block. And once I've done that and I've got those restorations milled, I waited for the abutments to come from the lab, and then we were able to put them together. This is actually the live milling using the Z4. You can see a few images there. And there's an example. This is pretty much a standard crown going onto a custom abutment. And you can see even in high quality, that took only 15 minutes. And that's a molar crown out of a feldspathic material. So the reason that's important is that with this feldspathic particular material, VITA's Mark II, you have the option of either glazing it or polishing it in the mouth. In Krina's case, because we have a lab here and we have a few different furnaces, we had it glazed, but you could, like we're going to do this afternoon, you could polish it in the mouth. So you have flexibility. you don't need to have a furnace for every single item if you're going to use chairside dentistry as an option. So here's some clinical pictures. This is again Karina's mouth, lower right side, and you can see the two custom abutments as they've been placed immediately. So they're on titanium bases, zirconia on top. Middle image shows where I filled up the screw access hole, and the third image shows those two very crowns that you saw in the design process having been fitted. So they've been cemented onto the abutments that are screwed into the mouth. All right, so that is how we can use chairside CAD with the implant module to go ahead and design, produce, and place restorations very predictably. There is the option in certain cases to do that a single visit. I, in this particular case, chose to do it over a couple of visits because my laboratory was involved. But let's say, for example, if you use the implant module and you wanted to do a screw retain restoration, whether it's single or multiple, you can go ahead and design a crown, cement it to a tie base, and screw it in yourself. No laboratory involved. But I wanted to use the opportunity here to do two things: correct the angulation of the implants because they were placed at angles to, let's say, deal with the anatomy and the nerve position. So we've corrected the angulation with custom abutments, but if you didn't have that issue, very easy to do everything without a lab. And now we move on to one of the other modules. This is Smile Creator. And yes, this is my nurse again, Karina. She's had a lot of treatment done in the last 2 weeks, and you may hear from her at the end of the session as well as to how she feels about it. We've been planning to do some work for Karina for a while, and I gave her the option of doing some of her anterior work that we've been talking about for a little while. This is Karina pre-op. So you can see the left image on your screen is showing her right-hand side. We have the central image and the left-hand side image. Close-up photography, this is the pre-op situation. What you can't see there is that we knew that there was some interproximal caries. The upper left tooth, most of that is composite. That tooth was heavily restored. It had a cyst enucleation, which we did last year. And we have x-rays to show that that's healed. So it was a good time to intervene, especially as you can see from that middle image right here, that was prior to her implant restorations going in. So everything was done in conjunction. We set up her posterior occlusion. We made sure everything was stable, and then we got into doing this, and you will see how just now. So we don't do this for every single patient. We don't take these kind of retracted images. This was done because in using the Smile Creator module, exocad's product asks for certain types of images, so smiling image, retracted image, and so on. And I'm going to show you how we put that data together. Again, we've scanned Karina. You can see her with the cheek retractor in. Again, same laptop. This is one of my other assistants, and we are scanning the current pre-op situation. Okay. Close up there, you can see that what we did later on was we used depth cutting burrs to do as minimal prep as we could. We removed existing fillings that were there interproximally. You may be able to see from that top left-hand side that the central incisors were slightly overlapped. So we talked about what we wanted to do and achieve there. Okay. Here is a shot of various different views, again with the Medit i500 scanner. You can see that I've used the reliability map there, and I've got lots and lots of green. So it was really happy with what I'd scanned and stitched it all together accurately. Top left image is the same thing in color. Okay, so what I did there was I collected my data, my pre-op data, and we threw it into exocad. You can see the same dental database here where I've selected my restorations. And what I've got there is I placed 7 veneers and 1 crown. The crown being on the upper left tooth, which had the cyst enucleation and endodontic treatment. So we wanted a stronger restoration there. I'd also had a discussion with Karina using the software as to what she wanted to achieve. And I'm going to show you that now. So we've gone through, and as soon as we've told the software that we're doing anterior teeth, if your reseller has activated the Smile Creator module for you, then it will give you that option. As you can see from the second image, it's saying, okay, do you want to use Smile Creator here? And of course we did, because we use this for our planning. And what it allows you to do then is take those 2-dimensional images that you've taken and merge that with your 3-dimensional intraoral data. And I'll show you through a series of images how we've done that. So you can see on the left image there that we've got our intraoral data, and it's been correlated with our static image to create this pattern. We then get asked by the software to outline the smile line, or the biggest smile that the patient's got at that stage, because then gives you the opportunity to modify that. Again, combination of two different data sets. And this is where things start getting a little bit more intriguing, a little bit more complex. And this is why I wanted to show you how powerful the chairside CAD product is, because what Smile Creator does is it enables you to place proportion within your design. Okay, so not just golden proportions, but there is a whole list of different proportionalities available, where the software will allow you to get an accurate horizontal. It will allow you to look at proportionality across the smile. So we've told it we're doing 8 units. And that way, with Krina, using these images, I was able to say to her, well, what would you like to change? What will you let me do? And you will see that coming up shortly. So we've got the interpupillary line that sets up our accurate horizontal. We've got our proportionality between the teeth. We then get the opportunity in the software to say, well, what kind of shade are we going to use here? How are we doing for time? All good? All right, so we look at what kind of shade we've got there, and the software allows you to put in the different VITA shades and propose to the patient. This is before we've touched the teeth, propose to the patient what the design might look like in their mouth, okay? Now, obviously, in this case, we did move forwards with it and we did prep the teeth, and this is me showing you 2 sets of data. So with the Medit scanner, what I did was I scanned her pre-op situation and I scanned her preparations. And I was able, with the exocad product, to bring both of those sets of data in. And you can see there what I've done with the preparation. So I've made the pre-op situation translucent so that you can appreciate the preps underneath. The 4s had no prep at all. Okay, maybe a little bit of occlusal reduction, but on the buccal surface, we were trying to widen the smile, so no buccal preparation. The others were as minimal as possible, and you will see I probably made my own life difficult by doing that. But, I have to sit next to this young lady every day, so I need to be happy with my decision and my ethics as to what I've proposed, what I've done. So I've gone ahead and scanned my data. The software then asks you, like we just did with Marion, where the prep margins are. So I've put that in. It's then used the algorithms to highlight where those minimum thicknesses are, where the spacer will be for cement. And now we get into the situation where we can choose our design and modify it. So like we did with Marion earlier, we have a database of 12 or more different sets of teeth, and you choose which is appropriate, along with what we will pick out from Smile Creator. You'll see that in a minute. This here is called chain mode. For me, it's the easiest way to set up 4 or 6 or more, in this case 8 teeth, and make them symmetrical and set it up really easily. And you can see I can do it in full color, so you can interact with the patient as well as in monochrome. From the occlusal view, you can see here the type of preparations that I did. You may have seen that Karina's got a deep bite. She has some occlusal complexities. And so on the veneer preparations of, let's see, 5 of the teeth, what we did was we wrapped the preparation over onto the palatal so that we have control of her incisal guidance. The crown was, as I would do normally, as a full crown preparation with a shoulder margin. All right. So now we get to see the proposed design over the preparations, and I've made those translucent for you so that you can have a look. And again, we involve the patient. You can see here now, if we then superimpose the proposed design over the static image, we can see, well, how might it look? Of course, that's a little bit extreme because it's a digital way of showing it, but I probably proposed it in B1, and we actually went with A1 in the end. Moving forwards, this is again a very important part of the design process. You can see the proportionality coming into play there. You can see that we tried to give her a design of tooth that had some characterization in it. You can see on the right-hand side image there, this library is called HD. And then we were able to modify and manipulate that library to make it customized to Karina's own particular case. Okay. Later on, and I'll show you how we did this, we did some laser work. So in this image on the left-hand side, this is a second scan with the Medit scanner, And you can see that on 3 of the anterior teeth, we did some laser work, and I'll show you why we did that in a minute. And again, we showed her the proportions. We showed her that we've got the horizontal correct, because naturally a pre-op situation had a cant to it. And we wanted to give her a straighter, wider, brighter smile. Okay, so we didn't do Krina's anterior case in one sitting. It would have been way too much. She's young and we didn't want to over prepare her teeth, and we wanted to give her opportunity. So what I'm showing you here on this screen is what we did with that initial design was we used the Z4 milling machine, and we used VITA CAD to go ahead and mill out 8 of those restorations in VITA CAD, which is a reinforced PMMA material. And then we use a temporary cement to place them. So that was done in one sitting. That then gave her time to go and test it, see how the occlusion was going to be. Also, you can see here that what we did, this is the temporaries in place. So this is Krina's new teeth, so she can go and test drive it all and see how it looks, how it feels, and we're able to modify the occlusion, okay? Everyone can see the camera, guys. So you might want to come back in here. Are you going down to the light?
This one on, this one on, so tell you.
Okay. Alrighty, so what we're going to do is carry on here, and I'll continue with the presentation. So you can see here, we chose the shade 1 and 2, which is pretty much A1. We also preoperatively used the easy shade to look at our accurate shade selection. And what we decided with Krina was that we needed to just raise the margin on the laterals because she had the opportunity. So here what I'm doing is just that, I'm using a diode laser to do that. I was then able to just pick up my scanner again, scan that area. You can see what's happening here is that by that time, I'd also fitted her lower right side implant restorations. So we had a more stable bite. So I incorporated that as well. And again, that's me scanning, different room, same laptop. And once I'd done that, we go ahead and finalize our preparation and design. So the design was approved, but what we did was where we lifted the gum margin on those 3 teeth, we were able to tell exocad that we'd like to just modify that margin. And as soon as I modified the margin, we got a nice rounded profile on those laterals, which you'll see shortly. And we were able just to change those 3 restorations rather than all 8 of them. Now, what this screen is showing now is the nesting of multiple restorations, all of them in blocks. These are VITA Inamic multicolor blocks, 6 or 7 shades in that block. And you can see what I've done there is I've nested all of them individually. Again, we then export that to the VHF Z4, and we milled all of those in one sitting. And pretty fast as well. You can see that's the product we've used, VITA's Inamic product. This is one of the veneers, just finished milling in the machine. And that was 11 minutes to mill a veneer out of Inamic, which is a hybrid ceramic, and that was using high quality milling. Okay, we're almost at the end of the presentation, and we will be going ahead and bringing Marian in shortly. We will then go ahead and ensure that his restoration is ready to fit. And the reason I'm telling you that is that's what this slide here shows. You can see the 8 veneers, 7 veneers, 1 crown. They're produced in VITA Inamic, this hybrid material. You can't put this material in a furnace, but in order to really show off the characteristics, the structure, the design, and more importantly, the multiple shades that are in there, we use VITA's Inamic glaze. Very, very easy to do. Literally paint it on, light cure it, and it will really highlight the structure and the design of that particular product. After that, the red image, the red and white image on the right-hand side is my assistant's etching with hydrofluoric acid the fit surface of these restorations. And you will see that we're going to do that now with Marian's restoration. And then we use the Inamic polishing kit to do the finishing in the mouth. And here is the fitted set of restorations. So this is 7 veneers, 1 crown. This is Krina's case finished. And this is after a few days of healing. So she did have some delay in the healing where we did some laser work, but the fit was absolutely spot on. You can see there where we've corrected the cant in her smile. We've got symmetry, we've got a wider smile, and maybe if she's brave enough, she might come up on the camera and allow us to ask her what she feels about it. But that's the design. Let me show you now what that's done for that girl. On the left-hand side, that is Krina pre-op. You may not appreciate it there, but this young lady really didn't smile very much before, wasn't confident showing her smile off. But look at her there on the right-hand side with her new smile. That's just earlier today. And I really hope she'll tell us how she feels about it and shares that information with us. So that's me done with the presentation. I've got to do a bit more dentistry now, so we're going to get our PPE back on. We're going to bring our patient back up here. The restoration is almost complete downstairs. Niall's down there with the camera. And we have Christine, our producer.
Yes, hi.
exocad
Hi,
team.
Gulshan. I thought I could just jump in with some of the questions while we're still waiting for the restoration to finish, if you're all right with that.
Of course, yeah, fire away.
Okay, fantastic. As regards to the scanning process, why didn't you use the HD mode with the Medit i500?
Well, that's interesting. Very interesting question. Yesterday's case, I did use the HD mode because of what I was trying to pick up. It was a difficult margin. It was partly subgingival and so on. That's the benefit of this scanner. It did all of that, picked up that margin, which was partly supragingival, partly subgingival. We had metal there. We had a temporary filling material, and we captured all of it in standard definition. So the answer is that why complicate it if you don't need to? The scanner can do it. And if I'd switched on HD, you would have had even more information. I hope that answers the question. Basically, I showed you what it does in standard mode. Believe me, it does even more in HD mode.
Okay, fantastic. We have one VITA related question come through. Why did you choose Trilux in spite of Inamic?
I wouldn't say in spite of Inamic. Inamic and Trilux. So Trilux just means it's a polychromatic material. The name of the material that I've chosen to use is VITA Mark II. It's a material that I have been using for, wow, since 2004, so 16 years. I have got restorations in that material that have been there 15, 16 years going strong. So in this particular case, I wanted to place the Mark II material being feldspathic because his adjacent teeth are porcelain and the opposing teeth are porcelain. And the way it feels to the patient's tongue is really important. Now, I believe that a glazed hybrid restoration is going to feel different. I know that because my patients tell me. And so in his case, I want him to have something that he's used to the feel of, okay? So that's why I chose it in this case. In Krina's case, I chose VITA Inamic because she's such a heavy bruxist, because we were doing an occlusal rehabilitation, because she's in protrusive guidance. So I was able to use that material, and I know that if she chips or breaks anything, I can repair it. In this case, we've got solid, stable occlusion, and yeah, I wanted to have porcelain there. It's what he's used to.
Okay, wonderful. Thank you. One question, I believe, in regards to Karina's case. For complex cases, do you use DentalShare to transfer the design to your lab?
I do, but in this particular scenario where I'm using chairside CAD, 99% of the time, I only open up chairside CAD because I've got the confidence to do the restoration from start to finish myself. The benefit of DentalShare as a part of the platform is that you can collaborate with colleagues worldwide, including labs, including other dentists. So the answer is yes, but in chairside CAD, I'm mainly doing everything myself. Otherwise, what I could have used any other structure as well, WeTransfer or anything else to move the data within Medit's own platform. You can link up with a variety of other colleagues and labs. So there are really a variety of ways to share the data. The reason I was using DentalShare for that particular element was I'd already done the design. And I think possibly the person asking the question is, do I use it to send everything over and get them to do the design? No. I could do because you have that option, but me personally, I like to do the design myself. There are many, many cases that my lab does from start to finish, but you know, I like to get involved as well.
Okay, great. Then one question in regards to the Z4. There's a question whether the milling machine isn't actually too noisy to be in a clinic reception.
I could ask my practice manager to come up and she could answer that because it's in her arena. So a couple of answers there. Number one, you have the option with that machine to have your reseller push a button and that it will reduce the sound by 30%, okay? And that makes it easily tolerable. Now, not that it isn't at the moment. I have it on full volume simply because it attracts attention. We want it to attract attention. We want people coming in to our practice to see it, and especially when it's milling. You know, even when someone's on the phone, you know, my colleagues can say on the phone, sorry about the noise, we're making a crown for someone, you know. So you can actually be positive about it, turn it on its head and say, yeah, it's noisy, but not in such a way that you couldn't take a phone call. Typically though, it's only noisy when it's cutting the large volume of ceramic at the start. As it gets into the intricate parts of the milling, it gets quieter and quieter. So it's not a noise that bothers me.
Okay, thanks very much. I'll share the other questions with you later and let you get back to your patients now.
We're going to bring Marion back up, so I need to get all my PPE back on, and we're going to go ahead and take you to the next stage of fitting this, and then we are almost done.
Great, thank you.
So I'm going to turn off the screen share. We'll switch back to the camera on here.
Gulshan, what is these components of your choice? So you've got Medit, exocad, VHF and VITA. Why, everyone will sort of say that their product is superior. Why do you as a clinician, 20, 30 years, why do you choose these products?
So really the easiest answer there, I've got to put this on, the easiest answer is to say that these are all open systems. It's not just the easiest answer, it's a lot of dentists, and I know and work with a lot of dentists are egotistical and control freaks, me included. And we all have our bits of OCD as well. We like to be in control. However, I appreciate there are people out there that don't want that, don't need that. Me particularly, I use this setup because I like to be in charge of the quality control. When I send something to the laboratory, I want them to be in charge of the quality control. So it's all about open systems that give me flexibility. It allows me to share the data, it allows me to use the data. That's really my best answer, Niall. I hope that covers it.
Sure, excellent.
So what we're going to do now is we'll get into the placement of the restoration. The thick surface of the onlay will be etched with hydrochloric acid for 90 seconds. It will then have an application of silane coupling agents, and then we will use a dual pure resin cement in order to place this restoration. Now, I'm standing up on purpose because this is how we tend to place these restorations, and that's how we will finish off today. It helps us with moisture control and giving a good line of sight to the actual restoration. Let's see. So what Niall's showing you over there is Karina doing the preparation of the ceramics. Head down a little bit. Thank you. So we've got good moisture control over here in the mouth. No bleeding at all. Now actually I might go ahead and put the cheek retractor in so that now you can get a better image, but typically we do this without. Just really important to get a dry field. I'm sure we might get some questions about why I don't do this with rubber dam. I use rubber dam pretty much every day, but for this kind of cementation, we have ways of getting a really nice clean dry field, and that's why we're standing up. All right. Cool. Thank you very much. Let's just dry that and see the preparation. Open for me. Thank you. So we've been able to do all of this without any local anaesthetic simply because it's a non-vital tooth, and that's made it a little bit easier today. You might now appreciate why it took so long to cut that restoration. I'm not sure now if you can show that on your camera or directly. There's very little left of that tooth. Okay. So, and that's because, firstly, we removed the very large composite, secondly, we removed the carious lesion, and then it was a case of making sure that we had enough height and thickness of tooth for strength of the restoration. So that's what we have. We'll be etching the enamel layer with phosphoric acid, and then we will be using self-etching dual cure resin cement shortly. You can work a little bit, but not for a little bit. All right, let me show you this as well. Can you show this? So this is an ultrasonic placement tip. Again, something I've been using for 12 to 15 years. What it does is it allows me to put ultrasonic pressure on the restoration to ensure that I've squeezed out all of the excess cement and have microfilm thickness. Okay, so we don't want big lumps of cement underneath there. We want really close contact between the restoration and the tooth. And then it will be like cured as well. How are we doing that? Good? All right, that's good. So here's our restoration, polychromatic. It's not been finished in the lab. It's going to be finished in the lab in a minute. The shiny surface underneath is cyan. What I'm going to do is just break it off the sprue. Okay, part of the sprue is attached, and we'll be removing that in the mouth shortly. Let's go ahead and finish our dentistry. Great, so we've got a dry field, we have got a dry desiccated tooth, and I'm going to go ahead and etch the enamel layer. This is, again, I said, dentists with their OCDs and their egos and idiosyncrasies as well. What I'm doing is, for myself, making sure that my bond to enamel is as high as possible in 30 seconds. Applying it, and then we will go ahead and test our restoration. We do not even try the restoration in until we have etched restoration. Good. Okay, this is important because you need to see how good these things fit. If I hold it there, maybe you come around from this side now. So, like a glove, I'm just holding it in place. If I let go, you'll see that it really does fit very well. I'll show you the mirror. That's the approval scheme that we put together, and you can see the screw on the buckle aspect. Okay, let's crack on, let's get it fitted. Right, I'm ready to mix these. Make sure that the fit surface is dry. I've got my resin cement here. I'm sure people will ask, so I'll tell you right now, this is GC product called GSAM. Has just turned the light to safe light so that it doesn't prematurely cure. And what I'm doing is I'm placing the resin cement around the outer margin, and I'm going to place a little bit in the middle. That's it. Then I go ahead and pick up my restoration and place it as we did before. I need to speak louder. Okay, so all right, so I've got my ultrasonic vibration tip. I'm just going to apply that pressure and activate that. That forces out the air and all of the excess smoke. Okay. Now, Creed's going to go ahead and flush cure the excess on the buckle. I'll do the palatal. The next few steps are very important. So what I'm doing is just knocking off the excess. You can collect that in the suction. And we need to work with a little bit of speed here because it's a self-testing product. So what that means is it will actually adhere to philosophy and it will stick everything together. So Trina will hold the restoration. Okay. And I will floss either side. So that's the medial. And that's posterior. Good. A couple of times. Because it's really not nice to send someone out with stuck together teeth. And then I go distal. And again, that's clear. All right, fantastic. So, almost there. Just going to give that a wash. Sorry, guys. So now Cleaner finishes off the steps of the resin cement and she's using LED curing light. While she's doing that, I switch to my instrumentation, and what I'm going to pick up now is a finishing burr to remove the screw. I will then sit the patient up and mark and tweak the occlusion if needed, and then we'll do some polishing in the mouth, and that will be our conclusion. If we have a few minutes, then we will ask the patient what he feels about what he's had done today, how it feels in his mouth, and then we can answer your questions again. So whether we're doing one or more restorations, if they're this kind of chairside restorations and we are looking to get a really nice clean dry feel, often we will stand up while we're doing it. It's just easier for me. Thank you. So all I'm doing is blending in the restoration with the three separation on all sides. And that's done. Do you want to have a look here now? So that's how we're looking right now with the screw having been cut off. That's our restoration. We're going to sit the patient up now, put the occlusion, and okay. Take this out. Okay. Thank you. So we tend to do this with the patient sitting up as much as possible so that they get a real idea of how it's going to feel. If the patient is horizontal, then it's not necessarily going to be accurate. And if you can look there, you can see that we have contact on the 7, on the 6, and the other teeth and series as well. So it's pretty much balanced, but I will want to just tweak it a little bit. Someone asked a question about materials, both dynamic and VITA are really nice and easy to adjust in the mouth. The other reason for going to Mark 2 is that it is aged like enamel and dental. So the wear characteristics are similar to that. It would have been different with enamel. I'm not sure if I wanted to put enamel above the zirconia restoration, which is implant retained. So just using composite finishing relatively the little adjustments here and there. More check it again. The head closed, and then I open, close, open, then check. Perfect. And you can see even more blue marks on his teeth, and look at that, that's pretty much it now. Just going to finish up. There's minimal adjustment because our version of chairside CAD has auto articulator. So it did the dynamic agreeable adjustment for me. Final step now, polishing. This is being done in the mouth, and we're going to use 3 or 4 different steps of polishing where we go from more coarse to more fine, and then a polishing paste at the end, and then we can ask Marion to tell us what we think. Thank you. Next one, please. So this is much slower speed, 8,000 RPM, water running, and all exposed surfaces plus the restoration to get polished. Now imagine that was a glazed restoration that we did place, and it needed a further adjustment. You would then use the glaze where you just adjusted it. And that would then mean, well, potentially you have to go back and add some more glaze to it. That's more time. But also, every time you add a layer of glaze, you just change the occlusion. So we tend to polish all of our posterior restorations when we're using this material, and we tend to glaze our anterior restoration. So if it was fore or anterior, it will be glazed, like we did the cleaners. And if it's 5 or distal, it will be polished. And in a moment you will see how shiny it will be. So light pressure, water running, about 8,000 RPM. Now in some countries, my colleagues will be polishing this out of the mouth, and the VITA does have a tip that you can use to polish this out of the mouth if you wanted to. Me personally, I tend to want to polish it in the mouth after my final adjustment. For the last 2 steps of polishing, it can be done in around about 50 seconds. So that was 3 steps of polishing in the mouth with water running. The 4th step that I use is with water lock, using a diamond impregnated polishing paste, and that gets a really nice shine on the surface. And then we finish it off with a little bit of water, and we are done. So we have done our diagnosis, we've done our preparation, we dealt with a little surprise on the 7th. We scanned him, designed, milled, and stitches. 1 hour, 40 minutes, but we've been talking, chatting, we did a presentation. I would say probably at real appointment time was maybe 1 hour 18, 1 hour 20. But for us, it's not about speed, it's about quality. So I'm going to let Marion sit up, have a little rinse, and then Niall, maybe you could ask Marion what he feels about what he's done.
For me, I thought that was really smooth and sort of, I think that there's general dentists out there, I don't think there's any part of that they couldn't take on themselves without some good training and to sort of support with it. Do you agree?
I think so, but my opinion is biased. I like your opinion because you're a technician. You can tell me what do you think about the fact that more and more dentists are able to get tools like this. Me personally, I collaborate with my technicians using this and other digital tools. But let's hear from this young man. How was that?
It was quick.
Okay.
It was really quick.
More importantly, how does it feel in your mouth?
It's a bit squeaky.
Squeaky. That to me means it's showing or smooth. Yeah.
Oh, okay.
Okay. So squeaky. I've never had a person describe one of my restorations as squeaky. So thank you. I'll take that as a compliment. How does the finish rinsing, right? But then tell us, how does it feel compared to the crown I placed on your implant last year, on the left side, just directly underneath? Does it feel the same or different?
Can you feel with my hand? I feel the same. I feel like my foot.
Fantastic. So I want to say thank you very much for letting us do this for you today. And then let's turn to Karina. Take the mask off. Come on, take the mask off. Right, that's Karina with her new smile. She's obviously hot and bothered underneath this mask and everything that we're wearing. Just tell us, what do you really feel about what we did and the way that we did it with your design, with Smile Creator, with what else did we do? We had the temporary restorations and now we've got the final. I know that you're in some pain still when you're healing.
Yes.
So what do you think of the process?
It was easy to understand why it would have to be done like that, even though my initial thought was like, does it have to take that long? Does it have to be done this way? But yeah, it did make sense. It was worth it. Gave me better confidence. Big smile.
And that planning prior or beforehand leaves a lot of the guesswork out afterwards. There's no surprises come fit day. There's no surprises come prep day. It's all in your head. So that extra couple of hours or planning can save you a couple of days in the future.
Absolutely. And that's what gave Karina the opportunity to see what it would look like digitally beforehand. And the provisional gave her an opportunity to see how it feels. Was it enough insight for you, or was it a surprise?
No, it wasn't a surprise. The end result was worth it. So yeah, all good. Thank you.
Let's get real close up to detail.
Not sure if you'll get in there, but go ahead and let's see.
Yeah.
Brilliant. Okay. Well, back to the studio, back to Christine in exocad TV and our director Nilu. I'd just like to say thank you to everyone that's allowed us to do this, to VITA, to exocad of course for being our digital host, to VHF, and of course to Medit for providing the scanner, to my team, to Marion, to Karina, and our cameraman today, Niall. Thank you all very much.
Thank you to you, Gulshan, and thank you to tonight's patient, Marion, and to Karina, of course. And thank you, everyone, listening and sending in your questions. I know we've gone a little bit over time, but we do have some more questions. So, Gulshan, if you're happy to take one or two more, that would be great.
You want to take a seat down so you can take all of this off. Give me 1 second, I'll just take all of this off.
Sure.
Okay. Fire away, Christine.
Okay, wonderful. So the first question is regarding the Z4. Okay. Is your lab using the Z4 for all your lab cases, or do they have another mill for lab use only?
Absolutely not. The Z4 is my toy. The Z4 is VHF's product specifically for use by dentists, and that's why it's fast. It's at 100,000 RPM spindle. It can cut a lot of different materials. I believe it's 48 different materials. It can cut titanium abutments from a variety of different manufacturers. So it's very flexible, gives the dentists that use it a lot of opportunities. So my lab uses bigger workhorse type of milling machines. So yes, they're made by VHF. They're slower, but that's because they tend to be working all day. When we're doing chairside dentistry, speed and accuracy is important. when we're milling all day, every day, bigger structures, labs need something with a different kind of workup, let's say.
So when we talk about this same day solution or workflow at your practice, when thinking about going digital, what are the costs that are involved to replicate the entire workflow?
The costs that are involved, I mean, I can tell you in pound sterling or euro, if you are making a restoration as we've done now using a VITA block, even with your tool wear and so on, that kind of restoration is around about 20 to 22 pounds, which may be about 25 euros. So maybe, I think in US dollars, that's maybe about 30 US dollars. Most of my clients that buy these systems from us, they lease them over something like 5 years. And it makes it not only a good tax deductible expense, but also affordable. So I'll tell you, on the average kind of price of a full ceramic restoration, usually 2 or 3 restorations a month, just a month, 2 or 3 restorations will pay for the lease. And then, as I said, each restoration after that is 20, 22, 25 pounds, depending on what materials you use. So really for people sending a lot of work to labs, I'm not saying they shouldn't, I'm just saying that there's an opportunity if they want to get involved in design and using exocad's products, VHF products, VITA's products, the whole mixture, they can access it. It is, I believe, affordable.
Great, thank you. Comparing this solution to CEREC, what do you think makes this workflow better, or how does the workflow compare?
CEREC is a viable option. I was a CEREC trainer. In my shed, I still have my CEREC machine, okay? So I bought that 2003. So I know CEREC well, and I have utmost respect for the guys at Sirona. But now is the day for variety, the time for variety. There's a lot more things out there in the market. In fact, if you had a Sirona scanner, you can use it with exocad software, okay? And the VHF mill. So you can mix things up to that extent. So my answer is, it's a great viable option using CEREC, but it's closed. This is wide open. It allows you to do more for less money and really collaborate with users worldwide, not just CEREC users, but everybody.
Fantastic. Thank you so much. Let's close on that note. Thank you very much, Gulshan, from everyone, again, at exocad, at Medit, at VITA, and VHF. To all the listeners, for further inquiries, please contact Dr. Murgai by sending an email to admin@implantsolutionsdirect.com. With that, thank you for attending. Have a good night and a lovely weekend.
Thank
Bye-bye.
you, Christine.